Hello, welcome back to our Integrative Women's Health course. Today's topic is going to be on the area of amenorrhea. Amenorrhea is a situation of the loss of menstrual cycle. A typical case study from Dr. Fang Qian is a 41-year-old woman visited him with amenorrhea for about half a year. Started after much stress from work. Now she feels tired, she had dry throat, she couldn't sleep at night with insomnia. And the first visit is September 12, 2005, and her last menstrual period is March 8th. So it's about 6 months that she's been missing the period. Her tongue appears to be pale, and her pulse appears to be thin and slow, thready and slow. And she had a pelvic exam as well as physical exam, and it seems to be everything is to be normal. And the definition of amenorrhea is lack of menstruation, especially over the age of 16. When you, from the very beginning, when you don't even have menstruation to begin with, we call that a primary amenorrhea. Or that a person might already have periods, but stopped for at least 6 months or more. We call that secondary amenorrhea. As early as 黄帝内经素问, it has described how 6 emotional injuries can cause amenorrhea. And it's true, frequently clinically, when you see amenorrhea, usually there's a trigger. Usually something precedes it that is very stressful for the body, whether it's a major loss or emotional stress or travel that's hard on the body. And so we need to also, in diagnosis, we need to make sure that we exclude the obvious lack of menstruation due to pregnancy, lactation, postpartum time, and menopause. And also there's a situation where patient has surgery or have lack of certain organs such as ovaries or uterus can all cause this condition. So looking at etiology and pathogenesis, there are several different reasons why this condition occurs. For example, when a woman who is 46 years old and has a XY karyotype instead of XX karyotype, this is a situation where you could lose the period earlier. Second, you could have anatomical abnormalities where, for example, the uterus is male-developed and the uterus is quite small and the lining is not built up properly, for example. Or you can have hypothalamic defects where the hypothalamus pituitary function becomes abnormal, becomes deficient, and there's not enough messenger hormones that comes down the pipe to tell the ovaries to ovulate properly. Some of these hypothalamic defects can all create problem as well. For example, also hyperprolactinemia sometimes can also stop the period, and in a situation of adenoma in the pituitary can cause a hyperprolactinemia situation. Other things such as ovarian failure. You could have an ovary gland, so that's completely shut down and cease to function properly. Or you can have ovarian dysfunction, where that there is a massive amount of cysts, whether functional or dysfunctional cysts, which can also cause and interfere with the ovulation process, and in turn interfere with the menstruation process. Obesity. In a situation of obesity, the metabolic picture changes, which the insulin level rises. There may be a situation of metabolic dysfunction, going toward diabetes situation, sometimes can cause a woman to lose her period. We also need to look at differentiation of internal structures. Internal structures such as Mullerian or Wolffian duct systems basically develop into female or male internal organs. In men, testes secretes androgens that stimulate the Wolffian ducts to develop into vas deferens, seminal vesicles, and ejaculatory ducts. Testes also secrete Mullerian inhibiting substances, MIS, that cause Mullerian ducts to shrink and disappear in males. In female, absence of androgen causes Mullerian ducts to develop into fallopian tubes, uterus, and inner part of vagina. And a Wolffian duct system degenerates in a woman's body. When you have a situation where a woman with a 46XY karyotype, this is a situation where there is a sexually undifferentiated male fetal testis, which secretes Mullerian inhibiting factor and testosterone. And this MIF, Mullerian inhibiting factor, promotes regression of all Mullerian structures, the uterine tube, as well as the uterus, and the upper two-thirds of vagina. So in this situation, you could have a situation where that the ovary and the uterus gets completely shut down. In looking at conventional Western medicine etiology, amenorrhea can be divided into anovulatory or ovulatory amenorrhea. Basically, is whether or not you ovulate or did not ovulate. So let's take a look at anovulatory amenorrhea first. This is a situation the body did not ovulate for whatever reason. The first reason could be a hypothalamic dysfunction, particularly a functional hypothalamic anovulation, where the messengers of hormones such as FSH and LH is not present, for example, or at a very low level, where it doesn't stimulate ovaries to actually grow the follicles. And the second could be pituitary dysfunction, where pituitary can grow tumors, can grow adenomas, where cause secretion, hypersecretion of prolactin, for example, and that can shut down the other female sexual hormones. The third could be a premature ovarian failure, where the ovary just gets shut down and doesn't ovulate at all. And the fourth is that it could be endocrine disorders that cause androgen excess, particularly when we see in polycystic ovarian syndrome. So now let's look at the ovulatory amenorrhea. A lot of times there's a situation where you're ovulating, but you still don't get your period. And big part of this could be a congenital genital abnormalities. First is cervical stenosis, where the cervix is completely shut tight, and that's rare. Number two, it could be in perforated hymen, where the hymen membrane are completely shut tight in the vagina. That's number two. Number three, you might have a situation of a pseudo hermaphroditism, and that can also create this issue. And number four, you could have transverse vaginal septum, where there's actually a divider in the vagina where that it shuts everything, retains everything. Number five, you could also have vaginal or uterine aplasia, which sometimes we call it Mullerian agenesis. Or you could have a whole category called acquired uterine abnormalities, where you could have Asherman syndrome, which frequently occurs after DNC situation or miscarriage situation. You could also see a situation of endometrial tuberculosis, can also attack the uterus and cause the uterus to completely shut down. You could also see this in obstructive fibroids and polyps. Normally, you still get your period with fibroid and polyps, but there are particular unique situations where that the fibroid is so obstructive, where the polyps is so obstructive that the uterus just don't have any chance to develop. membranes. And in Chinese medicine, the etiology really has 5 major areas. One we believe is a form of Qi and blood deficiency. Number 2 is kidney Qi deficiency. And number 3 is indeficiency with blood dryness. And number 4 is Qi stasis and blood stagnation. Number 5 is phlegm dam accumulation. So let's take a look at Qi and blood deficiency first. This can be a situation where a woman have constitutional weakness where their Qi and blood are already deficient to begin with, or that they've been suffering from chronic or major illnesses. Because as we know, when you have a chronic or major illnesses, this can consume and damage Qi and blood. In a constitutional weakness situation, combined especially with excessive worrying, when a woman worries a lot, think a lot, they sometimes could have and start having irregular food intakes where the appetite is decreased, they're not as hungry. And when that occurs, their taking in of nutrients much reduced. And that can cause spleen deficiency, which now unable to transform the food essence into energy for the body. And when that occurs, the nutritive blood becomes deficient. And when that occurs, you have both Qi and nutritive blood deficiency in this situation. Now, when you have chronic or major illnesses, this, of course, consumes the Qi and blood as well. And when that occurs, the body starts to take away the blood from the sea of blood, the Cong channel, for example. And that sea of blood becomes empty. And when that's empty, you have a very good situation of Qi and blood deficiency. So both constitutional weakness and chronic or major illnesses can be a big etiology for amenorrhea situation. The next one is kidney Qi deficiency. Kidney Qi deficiency can occur because of constitutional kidney deficiency. This is where the essence, both essence and Qi, is deficient, and where the tiankui is lacking, where the secretion of tiankui is weak. And that is a kidney Qi deficiency situation causing the loss of period. Or you could have excessive labor, miscarriages, abortions, sexual activities, which can cause damage to the kidney Qi, and that in turn can cause damage to the Cong and Ren function, And when that occurs, when you have a dysfunction of Cong and Ren, you're going to start losing your period. And hence, kidney Qi deficiency can cause a amenorrhea situation. The third etiology is indeficiency with blood dryness. You could have a case of constitutional in and blood deficiency, where there might be blood loss, which can cause a damaging to the yin and the blood. And that in turn can see the rise of deficient heat, fire dry condition, and where the fire can dry up the water element. So here you have a loss of menstruation because of it. Or you could have chronic or major illnesses where there's damage to the nutritive yin, the yin situation where consumes the blood, causes the blood to be dry. And this, again, creates the rising of deficient heat, and the fire dries up the water situation. Number 4, the Qi stasis and blood stagnation can be your etiology as well, especially when there is a chronic or typical liver stasis, for example, of anger, resentment. In this situation, this Qi stasis can cause blood stagnation. And as we know, when it's accumulated long enough, the stagnant blood can start to block channels. When it blocks channels, Qi and blood stagnation becomes the diagnosis, and then the blood flow ceases. Or you could be having a cold invasion during menstruation. When there's a cold pathogen invasion, it causes contracture of the blood due to cold. And when that occurs, the stagnancy occurs and the blocking of the Cong and Ren occurs. And this in turn creates this etiology of Qi stasis and blood stagnation, causing amenorrhea. The next one is phlegm damp. Well, when there is a typical chronic spleen deficiency, unable to transform food, it's also unable to transform damp. So when that situation occurs, dampness will accumulate and it will produce phlegm. So that's one situation. And the other situation, it could be the person's typically a phlegm damp constitution. So in both of these situations, phlegm damp blocks the Cong and Ren channels, or formation of phlegm nodules causing blockages of the blood flow. For example, it might be somebody who has a very large uterine fibroid or polyps, and it might be a phlegm damp situation, that can, for example, cause the stoppage of the menstruation. Now let's take a look at pathology. The location of this pathology is in Cong and Ren channels. In Western medicine, the location of this pathology could be in different places. Could be in the uterus, could be in the ovaries, could be in the pituitary, hypothalamus situation, could be in many different places. Now, there are two main scenarios. One, there's no blood to bleed, so where there's a deficiency in blood. Number two is that the blood is blocked, so it cannot bleed. Or a combination, so you have a situation of deficiency and an excess condition, and you could also have both combined together. So we need to learn how to differentiate between deficiency, excess, heat, and cold. But mostly, deficient condition trumps out the excess condition. You'll see a lot more deficiency condition in amenorrhea compared to excess conditions. So clinically, to arrive at the diagnosis, there's several examinations that we deploy. First of all, you can do a BBT, basal body temperature. This is where you can see whether or not the patient is actually ovulating or not. Number two, you can do a vaginal culture and take a look at if there's any bacteria. Take a look at if the hormone level is sufficient to create a period. Number three, you can also use an ultrasound to actually measure the actual thickness of a uterine lining, to actually look at the ovarian activity, see if the ovary is functioning at all. So that's ultrasound. Or you want to be more precise, you can always go to an MRI situation where you can actually be more precise in the measurements of follicles and the lining as well. Or you can do a hysteroscopy, where that through the vagina, you can send up a scope and take a look at the uterine formation, the contour of the uterus, and see if there's any blockages, obstructions, or uterine fibroids, polyp situations. Or you can do a diagnostic DNC, where that you can go in and scrape the lining and then try to stimulate the uterine lining to build up again, and then can kind of quote-unquote jumpstart this process. Or that you can also take the test of serum, FSH, E2, prolactin, thyroid stimulating hormone, or testosterone. These are some hormones that will give you some guidance of what to do. And then out of these, take a look at the mother karyotype, or take a look at the woman's karyotype. If the karyotype is XY, then you know this is going to be an issue. So in Qi and blood deficiency, we can see symptoms of missing period or delayed period, usually scanty, pale, thin flow, combined with fatigue, decreased libido, vaginal dryness, or atrophy. The tongue is usually pale, and the pulse is usually slow or weak. And so this is a typical Cong and Ren Qi and blood deficiency. Sea of blood is empty, so we want to tonify Qi, and we're going to try to regulate the blood. Okay, so the formula we use a lot in this situation is 人参养龙汤. 人参养龙汤 is a typical, very nice, very strong, strengthening Qi and blood formula. So it's a combination of 人参, 黄芪, 白术, 茯苓, 陈皮, 甘草, 熟地当归白芍五味子远志 and 肉桂. You can, with this as a base, you can add 紫河车 or 鹿角酸 鹿角酸 or 鹿茸 for Qi Deficiency. So you can add some of these additional herb into the mix. The next etiology and syndrome is the Qi Deficiency. We tend to see this in primary amenorrhea or delayed menarche situation. This can be a gradual onset of amenorrhea. There's fatigue, there's poor development of the physique, poor secondary sex characteristics, poor development. You can see tongue is pale, the coating is dark coating with thin white, and the pulse is deep and threading. So in this situation, we want to tonify kidney, benefit qi, and regulate chong and ren. So the formulation that we have basically selected is modified 从容兔狮子汤. Okay, this is a very famous formula that come out of a wonderful professor, Dr. Zhuo Yulong from Sichuan province. It's a combination of 肉苁蓉, 兔狮子, 覆盆子, 枸杞子, 三寄生, 熟地, 当归, 艾叶, and you should add 紫河车 and 鲜荇皮 into the mix. Okay, a wonderful formula that's used for kidney Qi deficiency amenorrhea. Now let's go to indeficiency blood dryness. This is a situation where there's amenorrhea with delayed menstruation. There's prior history with scanty red thick flow, gradual onset of amenorrhea. Tongue is red, coating is lacking, and the pulse is thin and rapid. So here we need to nourish clear the He, and regulate Chong and Ren. So the formula that we have selected is Yi Yin Jian. Yi Yin Jian is a combination of Sen Di, Sao Yao, Mai Dong, Dan Sen, Shou Di, and Niu Xi, and Gan Cao. Okay, so this is the herb that's in the indeficiency and blood dryness. So let's go to the next one, Qi stasis and blood stagnation. This is a situation you're going to be seeing losing a period. The tongue is purple dark with stagnancy spots. Pulse is deep, wiry, and sluggish. So we need to regulate qi, activate blood, get rid of stagnancy, to regulate menstruation. So the formula we use is a typical formula of blood activating herb is 血府逐一汤. 血府逐一汤 is the 5 逐一汤, one of the 5逐一汤 that focuses on abdomen areas. This is a combination of 当归, 生地, 桃仁, 红花, 止咳, 赤芍, 柴胡, 甘草, 桔梗, 川芎, and 牛膝. So the next etiology is a phlegm, damp, blockage. This is a situation you're losing your period. There's prior history of delayed menstruations with scantier flow, pale sticky flow. There's a gradual onset to lacking of period and losing period. There's also some gradual onset of weight gain, greasy coating, and the pulse tend to be slippery. This is a situation of phlegm, damp, blocking of Chong and Ren. So the treatment principle would be to strengthen spleen, dry up the dampness, and dissolve phlegm. So the formula that we would use is a combination of 四君子汤 plus 仓户岛糖汤, as well as 当归 into the mix. So this is a combination of 党参, 茯苓, 白术, 苍耳子, 香附, 半夏陈皮, 党南星, and you have 生姜, 神曲, 当归, and 川芎. Okay. So coming back to this case of Dr. Fang He Qian, 41-year-old, First visit September 12, 2005. Amenorrhea for half year. Started after much stress with work. Now feeling tired, dry throat, insomnia. Last period is March 8th. And the tongue is pale, pulse is thin and slow. And had a physical exam and everything seems to be normal. So this patient has been diagnosed of having liver stasis spleen deficiency. So the treatment principle is to regulate liver and spleen, tonify qi, and nourish blood. And so he uses the modified Hegan Tang. Modified Hegan Tang. Hegan Tang is an experiential formula of Dr. Fang. And the composition is Dang Gui, Bai Sao, Dang Shen, Cai Hu Fu Ling, Xiang Hu Bai Zhu, Su Gen, Da Zao, Bo He, Zi Gan Cao, and Shen Jiang. And the formula that's used in this particular patient was this formula and of Dang Gui, Bai Sao, Dang Shen, Cai Hu, Fu Ling, Xiang Hu, Bai Zhu. And Su Gen, he did not use in this situation. Da Zao, Bo He, Zi Gan Cao. And he also get rid of Shen Jiang in this situation. And he added Shen Di and Shou Di and Zhenan and Dang Shen. Prescribed about 10 bags for the patient. She would be to drink for 2 days, stop 1 day, drink 2 days, stop 1 day. Very unique way of drinking, unique way of decoction and taking this medicine. So on the second visit, which is October 24, 2005, patient comes back and has reported that her energy has improved, but no period yet. There is some pelvic discomfort, which we like, with increased vaginal discharge. The bowel movement is normal, tongue is still pale, and the pulse is even and slow. So Dr. Fang decided we'll stay with the same previous formula, but we're going to do a little tweaking. So he used the same previous formula. So he adds Sanzhuyu, 6 grams. He adds Mai Dong, 10 grams, and about 10 bags of tea to drink every other day. And the next visit is basically 2 months later, December 15, 2005, which is the third visit. Period actually returned on December 11. Absolutely great. Though scanty flow for 2 days, dark color, pulse is even and slow, tongue is pale. Now this is a Qian blood deficiency, therefore the menstruation, the blood is light. So we need to tonify Qian blood more in this situation. So he decided to use a modified Zi Bu Tang, modified Zi Bu Tang. Again, this is an experiential formula for Dr. Fang. So Zi Bu Tang is a composition of Dang Shen, Bai Zhu, Fu Ling, Zi Gan Cao, which is that is Si Junzi, plus Shou Di, Dang Gui, Bai Sao, you get rid of Chuan Xiong, and you add Gui Zhi, Chen Bi, Mu Xiang, and Da Zao into the mix. So this is a Zi Bu Tang formula. It's a very nice formula to be used to tonify blood, to tonify qi at the same time. So the formula that's used in this particular situation is Dang Shen, Bai Zhu, Fu Ling, Zi Gan Cao, Shou Di, Bai Sao, Dang Gui, and Gui Zhi, Chen Pi, and Mu Xiang, Da Zao. And we're going to add a few extra herbs, adding Shou Di, Gou Ji Zhi, Mai Dong, and Zhijiang Qi, 12 bags, and drink every other day. Drink every other day. Okay. So Dr. Fang Hejian was born in 1923, and he was one of the chief physicians in Caoyang Hospital in Beijing, famous for difficult cases, pulmonary heart diseases, and hepatic disorders. He's a student of one of the last imperial physician, Dr. Zhao Yinqing. Dr. Zhao Yinqing. So, as a few last words I want to leave with you is that the cause need to really focus on liver, spleen, and kidney. These are 3 organs that really are the cause of this amenorrhea situation. And the leader of it is always the Qi deficiency. And so currently there are 3 types of approaches of treatment to treat this. One is just do a syndrome treatment, which is what we just did. Or second, we can do phasic treatment, take a look at what phases where the patients are in. And the third is that you can do both. Integrative Western medicine, where you can bring some medication, and as well as a combination of TCM treatments. And I think the third part, it's going to work so much better for people who's been missing the period for quite a while. So thank you so much for the opportunity for me to share this knowledge with you. And I hope this has been enjoyable for you, and looking forward to seeing you next time. Take good care.